Introduction. Welcome to today's lecture on the fascinating field of endocrinology and the various hormonal changes that occur with aging. As medical professionals, it is crucial to understand the intricacies of the endocrine system and its role in maintaining overall health and well-being. Now, let's dive into the different aspects of endocrine dysfunction and its impact on aging processes. The hypothalamic pituitary gonadal (HPG) axis plays a pivotal role in reproductive health and sexual function. However, with aging, this axis undergoes significant changes, leading to dysregulation in hormone production. Reduced levels of gonadotropin-releasing hormone, GnRH, and luteinizing hormone, LH, contribute to the decline in testosterone and estrogen production. These changes result in age-related alterations, such as decreased libido, erectile dysfunction, and changes in menstrual patterns. The growth hormone insulin-like growth factor, GHIGF, system is essential for growth, metabolism, and tissue repair. However, as individuals age, the production and secretion of growth hormone, GH, decline, leading to a decrease in IGF-1 levels. These changes contribute to the loss of muscle mass, reduced bone density, and increased adiposity commonly seen in older adults. Endocrine disruptors are environmental compounds that interfere with hormone functioning. Exposure to these compounds can have profound effects on aging hormones. For instance, certain chemicals can mimic or block hormones, leading to imbalances in thyroid function, reproductive hormones, and the stress hormone cortisol. This topic explores the potential long-term consequences of endocrine disruptor exposure on aging-related hormonal changes. Alzheimer's disease and other forms of dementia are associated with significant neuroendocrine changes. Disruptions in the hypothalamic pituitary adrenal (HPA) axis and dysregulation of cortisol secretion are commonly observed in these conditions. Additionally, alterations in insulin signaling and the growth hormone axis have been implicated in cognitive decline. Understanding these neuroendocrine mechanisms is crucial for developing targeted therapies for Alzheimer's disease. Thyroid hormones play a critical role in metabolism, temperature regulation, and energy balance. However, as individuals age, the sensitivity of peripheral tissues to thyroid hormones can diminish, leading to a condition called thyroid hormone resistance. This topic delves into the mechanisms underlying thyroid dysfunction in aging and its potential impact on overall health and well-being. As we age, significant changes occur in the metabolism of androgens, which are primarily represented by testosterone. These hormones are crucial for various aspects of male development and the maintenance of reproductive function. It is observed that aging is linked to modifications in how our bodies process and utilize androgens, resulting in a decline in testosterone production and an increase in estrogen conversion. These alterations are implicated in age-related conditions affecting the prostate, such as benign prostatic hyperplasia, BPH, and prostate cancer. As individuals age, they commonly encounter frailty and sarcopenia, which are significant hurdles. Hormonal alterations play a significant role in the manifestation of frailty and the decline of muscle mass. Diminished levels of growth hormone, testosterone, and insulin-like growth factor 1, IGF-1, have been associated with these conditions. A deep comprehension of these hormonal changes is vital in establishing effective interventions to alleviate frailty and sarcopenia among the elderly population. As we age, the stress response system, which is governed by the HPA axis, hypothalamic pituitary adrenal axis, undergoes changes. Chronic activation of this axis can result in the dysregulation of cortisol levels, a hormone released by the adrenal glands in response to stress. This video section will focus on the effects of cortisol dysregulation in aging, including its impact on cognitive function, immune system response, and overall health. By understanding these hormonal changes, we can gain valuable insights into the aging process and potential interventions to improve health outcomes. Melatonin, a hormone produced by the pineal gland, plays a vital role in the regulation of the sleep-wake cycle. As individuals age, the production of melatonin declines, resulting in sleep disruptions and insomnia. It is crucial to comprehend the significance of melatonin in sleep disorders associated with aging to formulate efficient treatment methods. By understanding the impact of melatonin on sleep, healthcare professionals can develop targeted interventions to improve sleep quality and address the specific needs of older adults experiencing age-related sleep disturbances. As individuals age, there are notable variations in parathyroid hormone regulation and its effect on mineral metabolism. Parathyroid hormone, PTH, plays a crucial role in upholding adequate levels of calcium and phosphate in the body. However, with the aging process, there is a decline in PTH secretion and a decrease in its effectiveness. These alterations in PTH function have significant implications for mineral metabolism and bone health in older adults. Ultimately, These changes contribute to the development and progression of age-related bone disorders, including osteoporosis. As we age, there are changes that occur in the function of gonadotropin-releasing hormone, GnRH, neurons, which play a vital role in regulating reproductive function. These changes can result in a decrease in the secretion of GnRH. In this section, we will discuss the intricate mechanisms within the hypothalamus that contribute to the age-related dysfunction of GnRH neurons. Understanding the impact of these changes on reproductive health is crucial for managing age-related hormonal imbalances and related health issues. Cognitive decline is a common hallmark of aging, and neuroendocrine changes contribute significantly to this process. Dysregulation of multiple endocrine systems, including the HPA axis, sex hormones, and insulin signaling, can impact cognitive function. Understanding the complex interplay between hormones and cognition is crucial for developing strategies to preserve cognitive health in older adults. In conclusion, the study of endocrinology and its relationship with aging provides valuable insights into the complex web of hormonal changes that occur throughout the lifespan. From the dysregulation of the HPG axis to alterations in growth hormone production and the effects of endocrine disruptors, these topics shed light on the impact of age-related hormonal changes on various aspects of health and well-being. As medical professionals, it is essential to extend our understanding of the endocrine system's role in the aging process, as this knowledge can guide clinical practice and the development of targeted interventions for age-related endocrine disorders. Thank you for your attention, and I hope this lecture has deepened your understanding of age-related hormonal changes in endocrinology.